very variable. Sometimes there can be good control, sometimes it may not have any control at all. So one of this incident happened with Suman's parents when Suman was born, and unfortunately she had some problems in her spine. And this is such a common condition in India. Every year out of 1,000, 2 to 4 kids are having this problem. So this is such a common condition, and so many babies and parents are suffering with this. So over the years, I will say here I am not only to tell about this case and what we have done. I will say we are here to celebrate the courage of Suman and her parents, because suffering through such a difficult thing, she is well educated, she is independent, she is earning. So this is a kind of thing where baby is born with so much problems, but parents did such a good work. She was so courageous, and she is earning and totally independent in her life. So what we just are playing very small part in her life and in their happiness. That what was happening over the time, the only thing that she was dependent upon her parents for her bowel evacuation. Like we can sit and do the motion freely, but she was dependent upon her parents. Rest all she is doing by herself. So what for this operation was done around 10 years back in a very renowned hospital by a very good surgeon, and operation was a successful. But there was some infection after that, because of which it has to be closed. This is something called as, like if I tell you in a simple way that you sit and do motion, but if you cannot do it, you get some support from here, some fluid will go and it will come out, motion will come out. So what we had to make a small hole so that motion can be cleared. Surgically it failed, so we have thought of doing it endoscopically. So they met first Suman's father to Dr. VVS Chandrasekharam, who is just busy in complicated surgery, so he will be joining us soon. So they met him, ki, can we do something? So sir discussed with me, ki, Parijat, can we do something, because one surgery has been failed, so can we do something even less invasive? So we have discussed, we have looked at the literature, and we have come out with the colonoscopic procedure. So we have done colonoscopy, and through that only we have put a small tube in the tummy. And from that day onwards, the support of parent for passing motion has become very simple. Now most of the things Suman can do herself, and the rest of the things even parents can tell you about that. And this procedure has never been done in India as per best of our knowledge. Even all over the world, I could get 3 or 4 times this surgery has been done in selected patients. So, and this is after 1 month that we are talking to you, when we feel really this operation has been successful. And child Suman was discharged next day without any painkiller, nothing, no stitches on the body, nothing. So this is a kind of surgery and advancement that we want. So we are very thankful to Suman's parents for supporting us and giving us confidence to go ahead with the procedure. For Suman for dealing with us for this procedure, for the surgical team, Dr. VVS, Dr. Khyati, and yes, finally all of you for being here. And most important, I will say, of course in Ankura I have done a procedure. This is a kind of individual thing that we have done and we are showing. But the more important, we need to know about this problem is Spina Bifida. So many kids are suffering, and they all need some kind of support so that the children can become independent like Suman, and parents can get support so that they can see their children growing in front of their eyes, and they can be happy that they are doing good in their life. Thank you for your patience.
Ankura got in touch with Spina Bifida Foundation, Dr. Karmakar's team in Mumbai. And we wanted to initiate and take the foundation forward, and we inaugurated the Spina Bifida Foundation Telangana chapter in 23. So in 2024. So hello, yeah, okay, yeah. So in 23 when we began, we had hosted a CME, and I worked very closely with a lot of individuals with Spina Bifida. Suman happened to be one of them. That's how I got in touch with Suman, and also Sudhakar sir. So together when we were organizing this CME, we got in touch with a lot of individuals with Spina Bifida, their problems, what problems they faced during their growth period, during their schooling, during their occupational period. And together we understood how doctors, society, family, teachers, everybody together play an important role in making the lives of Spina Bifida individuals and their families easier, fruitful, and functional. So, with that in mind, together we set out on this journey, and through that journey, we came to know that Suman was having this issue. So, we put our heads together, and it was Chandrasekharam sir's initiative that we could do this endoscopic procedure, and we researched about it, and then we approached Parijat sir, and he again together we sat together, we formulated how we can go about help Suman. So we evaluated, and then we understood that this can be done in Suman, and we proceeded, and I think the outcome was wonderful, and we can see that from the smiles on the parents' faces. And yeah, with this, we would also like to carry forward the message that spina bifida, it is an issue which starts from birth. It can be difficult at times, but there are solutions, and when we join our hands, we can definitely make such individuals' life more fruitful, and they can become functional individuals and independent individuals in the society. So, as a coordinator of Spina Bifida Foundation Telangana chapter, I would strongly encourage parents, patients to come forward if they need help in any way. The foundation is there for you. Parents, other individuals, adults with spina bifida are here. The experience can help. We can share our thoughts. We can take things forward and make their lives better. And also, I would strongly encourage everybody to remember one simple thing: folic acid before frolic. So every woman in the reproductive age group, please start folic acid. It's a single tablet each day. Start it 1 month before you start planning to become a mother, before conception. So one tablet each day, 1 month before you plan to conceive. Thank you so much.
So before surgery, okay, the frequent soiled clothes అందుబాటులో ఉండేదాన్ని అండ్ ఇప్పుడు కొంచెం డ్రైగా ఉంటున్నాను అండ్ బిఫోర్ సర్జరీ ఎనిమా ఫిజికల్ ఎనిమా తీసుకునేటప్పుడు కూడా లీకేజెస్ సపోర్ట్ అవసరం వచ్చేది అండ్ లీకేజెస్ బాగా ఉండేవి అండ్ త్రూ అవుట్ ద డే లీకేజెస్ అండ్ ఇప్పుడు లీకేజెస్ లేవు అండ్ దట్ యూస్ టు టేక్ అ లాట్ ఆఫ్ టైమ్ బిఫోర్ ఫిజికల్ ఎనిమా అండ్ ఇప్పుడు ఇట్స్ లైక్ అరౌండ్ హాఫ్ అన్ అవర్ టైం కూడా రెడ్యూస్ అయిపోయింది అండ్ ఇట్స్ క్లియర్ మంచిగా క్లియర్ అయిపోవడం అండ్ ఇట్స్ యా సో డ్రై డౌన్ ఇండిపెండెన్స్ కూడా అండ్ ఇన్ఫెక్షన్ స్కోప్ తగ్గిపోయింది ఇప్పుడు లీకేజెస్ ఆగిపోయినాయి సో హెల్త్ కూడా ఇంప్రూవ్ అయిపోయింది అండ్ కాన్ఫిడెన్స్ ఇండిపెండెన్స్తో పాటు ఆబ్వియస్లీ కాన్ఫిడెన్స్ కూడా వస్తుంది